Our next speaker, Dr. Hemaya, who will be presenting in place of Dr. Manek Nicholson. She'll be presenting on the magic of, simulation training for SICS.
Okay, good afternoon everyone, and my regards to everyone on the dais, and special thanks to Dr. Sahu sir and Dr. Buramani sir to give me such a beautiful platform. So I'll be talking on simulation training in SICS. So basically it is important for those who have got very insufficient surgical training, like in COVID time every one of us knows. Of course, to learn a better handling of the instruments, to achieve perfection in a particular step, shorten the learning curve, and also to have least surgical complication in live surgery. This Help Me See simulator is the only simulator available to rate. It has high fidelity, 3D virtual reality with tactile feedback. That means you can feel the tissue. This is how the simulator looks. It has the eyepiece same like our operating microscope, where you can adjust the IPD as well as refractive error. And it has a screen attached to it, from where I will just tell you how to do it. These are the handpieces or the haptics with wings. Basically, we use this for the surgical process in the simulation. This is a touch screen with which we choose particular step we want to perform, and also the instruments which we require to perform the surgery. In Help Me See, we are actually dividing the surgical steps in 4 modules, and we have actually 12 simulated steps. Now I am going to show the interesting part, how we approach. We are making the groove now with the crescent. You can see the surgical tools on the screen. Now we are approaching, now we are going to make the tunnel. You can see the IOP variations when you are making the tunnel also. So this is how we are making the tunnel. Now here we are proceeding and making the paracentesis with a 15 number stab blade. We have to just change the instruments which we select from the screen. So this is a paracentesis. Now we are going for viscoelastic injection. And now we'll proceed with the keratome entry. The green line shows the inner limit of the tunnel from where you have to enter with the keratome and complete the entry in SICS. Now we'll be proceeding towards the CCC. The most important part and the most difficult part for students to perform. So here we take a cut, inverted C or J-shaped cut. We make a flap, just like how we make it on our normal surgery, routine surgery, and proceed same like how we do it in the live surgery. It's very beautiful to see because you can feel the texture of the capsule even. So the simulation is actually very, very near to normal. Now suppose you have a complication, okay? So the screen will show you and the cystome will turn red, and it will show you the tear run out on the screen itself. Now we'll go with the hydrodissection step. Here we have chosen the saline syringe as an instrument. Now we are performing the hydrodissection here. See, the nucleus turns up. It's very, very beautiful. And now we are having nucleus dislocation. We use Sinskey hook here as an instrument. We go inside, and with cartwheel fashion, we are turning the nucleus up, and it will be in the AC. Okay, now this is my favorite step because it looks very, very original. So we use here wire vectis, and we are engaging the nucleus here. With the colibri, I am giving the pressure downwards, and here the delivery is complete. So now we'll just see how the cortex removal is done. Here we use Simcoe. We have even from the side port entry also. Here I am showing you from the main tunnel itself. This is how the cortex aspiration looks, very, very beautiful, as original as it's required. Now if you have a complication in Simcoe, it will be seen like this, capsule aspiration. Also, like zonal breakage, if you are being very harsh, it can be shown there. Now we are inserting the intraocular lens in the bag. Here we are using McPherson. Now we are putting the lens in the bag. And you can see the red dot by showing that the lens is in the bag now. So even that is been taken care of in the surgical tools. So now in future we are actually completed the module of complication management, where we have dialing of the ACL in the AC, sphincterotomy, and always also the CTR. And even we are be launching phacoemulsification module in 1 or 2 months. So in training, we are actually giving the students ebook to self-study. We are taking the classrooms of the students because they need to have the basic concepts clear. We have lab activities on tomatoes and potato peeling. Also, we are giving simulation hand-based training and debrief sessions. Thank you so much for the patient listening. Thank you so much.
Thank you so much, madam. It was like a aviation simulation, you know, where you can even,
flight safety.
yeah, wonderful machine. I think you all should experience it once.